and she can't eat.
82-year-old Kimberley-based Ada Topken is a cancer survivor. Topken was diagnosed with breast cancer in 1994, which then spread to her back. She went into remission, but the cancer came back twofold. Her last chemotherapy was in 2008. With excessive of chemotherapy, Topken maintains family support is key to fight cancer.
With the chemo, I had a lot of vomiting and nausea. It was terrible. And you feel tired all the time, and you definitely need your support group, your family. And the doctors were my support, and the nurses were my support group, and even my colleagues at the clinic were my support group. They really helped me through that trying time a lot. I can tell you, chemo is frightening. And when people hear the word cancer, they think it's a death sentence, and it isn't.
The Cancer Association of South Africa says most cancer-related deaths are due to late detections. Most victims suffer from cervical, prostate cancer, and lung cancer. The association maintains people should be able to see differences in their body.
I also want to talk about the warning signs of cancer and how we can really be aware of things that change in our body. So we often know that, changes in our body, when there is changes, like if you suddenly have diarrhea, or you have constipation, or you have discomfort, abdominal discomfort, loss of weight, anything that changes in your body always talks to you, and it tells you when something is wrong. Listen to what your body is saying. Go and get yourself checked up by a healthcare professional. Don't self-diagnose. Don't always resort to Google and social media to find your answers. Go and have your investigations done. You have a right to a second opinion if you've gone to a healthcare provider, or you've gone and it's come back and it's saying that, everything's clear, and you don't think, but you still feel like there's something wrong with you.
Oncologists insist one should do regular tests and screening to avoid late detections.
People must go for screening tests, especially for cervical cancer. It's very common. As I said, the commonest cause is human papilloma virus. If you go for screening, we can do a test for human papilloma virus. And if you have it, there's a way we can deal with that. In addition to that, there's what we call a pap smear. And we advise that any lady who turns 20 years should go for a pap smear. If the pap smear is ready, is normal, it should be repeated at least every year.
Experts say there are different types of tests for different cancer types that they advise should be done at least every year. Karabo Siyoko, SABC News, Kimberley.